Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
Good morning. We are back at the Chiropractic Legal Injury Conference, and we are joined today by Dr. Steve Giacoppo, a gentleman who I've known for at least 15 years and have had the pleasure of working on, I would say, about 1,000 cases with your office over the years. So we have a perfect record together, incredible success rate, and it's been an absolute honor and privilege to work with your office, you, Dr. Keller, and you guys always go above and beyond for our clients, your patients, and I just wanted to thank you for being part of the conference and being part of the first ever multidisciplinary panel.
Thank you. I appreciate it, and it's an honor to be here. I always think of Larry as being in the top of the top for legal representation in the state. Anytime I see a patient that has Larry representing the client, I already am totally relaxed, and I can just do my job as a physician.
Yeah, I always say when they come to your clinic, look for the guy that looks like Marlon Brando. That's the one you want to go see. So tell us a little bit about what you do at Comprehensive Pain Management.
So for me, I'm a nurse practitioner, and my role in this in comprehensive pain management is to really evaluate the patient initially, diagnose their medical conditions, and that might be a real comprehensive workup with a good detailed history and examination. I always say accurate diagnosis leads to accurate treatment. So then I'll make sure if a referring physician has sent a patient to me, I take a look at what's been done and what has not been done. Sometimes they've done, if it's a chiropractic physician, they might have done x-rays in office, but they haven't done MRIs or some further advanced diagnostic imaging. So I'll make sure that those things are done. Once we have an accurate diagnosis, then my first role is trying to co-manage the case with the treating physician. And it could be prescribing medication. I always think of an algorithm of giving the patient time, giving the patient chiropractic care because it's passive and conservative, prescribing medication from my end, referring for physical therapy and exercise rehabilitation. And then when those things work, then that's probably going to lead us to a resolution. If the patient is still having problems, then that's where we come in as a pain management practice to do higher levels of service, which would involve my partner, who will do an additional podcast here soon. And that could come from anything from further diagnostic testing like EMGs, NCVs, because he's physical medicine and rehabilitation, to doing things like actual procedures to help the patient get better, epidurals for disc-mediated pain, radiofrequency treatment for facet-mediated pain, ultrasound-guided injections, and advanced procedures like regenerative medicine, PRP, stem cell.
Yeah, you guys do a wide range of services, and for me, the most important, in addition to excellent bedside manner and excellent patient care, is documentation as well.
Yes.
And you and I worked on so many cases together, and I'm always harassing you for reports and follow-ups and whatnot.
Yes.
Can you tell us a little bit about, in your experience, the impact that excellent documentation has had on cases you've worked on?
Yeah, so in the end, you have to be able to justify the treatment that's being rendered, not just by yourself, but by all providers involved in the case. And so if you're doing the right things for the right reason, that should be expressed in the course of their documentation. And ultimately, if there's a chronological order to the things that are done to help the patient get better, by the time Larry has the case and he's presenting that in front of an insurance carrier, he can justify all the treatment that was done, the rationale for why it was done, and then how we arrived at a great outcome for the patient. And if there isn't a good outcome for the patient, or there's going to be some residual problems, maybe a futures report or something like that can help explain what the patient not only needed to get to the point that they're at now, but maybe what they'll need in the future. And that helps Larry as well.
Yes, absolutely. Now, you are uniquely related to the chiropractic profession. So
Yes.
tell us what's so special about working with you, and in particular at this chiropractic convention, what your experience is like working with chiropractors, and what unique credentials do you have that makes it different when working with your office?
Yeah, thank you. I started out as a doctor of chiropractic, and I did that for about 20 years, practicing with my brother. I was even a state representative for one of the boards of the chiropractic. And so for me, I just wanted to expand my scope of practice. In chiropractic, it's drugless, non-surgical, non-invasive, and an opportunity came up to go back to school, and they took a group of practicing chiropractic physicians and gave them a pathway to get their NP license, and I jumped on that. And I always wanted to, from the very start, I've always integrated myself into the medical community. I always felt like the best care is collaborative care with a combination of all providers. No one provider can treat a patient completely. It generally takes a team of providers to get patient a great outcome. So for me, this was just a natural flow for me. But coming from that background, I have a conservative background. I always try and take the path of most conservative treatment, and the condition will speak to us, let us know how the patient is progressing through the course. And if they're doing well, then we can stay that conservative path. And a lot of chiropractors like that. And if the patient's response to care is a little bit slower, more guarded, or needs something beyond that, then we have a plethora of doctors, neurosurgeons, orthopedic spine surgeons, neurologists, psychiatrists, psychologists that we can call upon to incorporate into the patient's care.
Yeah, one thing I absolutely have to commend you on is your attention to detail. And every time I start talking about you, I think of this one case where I referred it to you for a client who had chest pains. And when he went to the emergency room, they did the CT scans, they did the x-rays, they couldn't find what was wrong with him. So they thought it was a heart condition. They ran the heart tests, couldn't find what was wrong with him. And for weeks, this guy's suffering with significant chest pains. So we referred him to pain management, your office. And I'll never forget this. I'm with my now wife. We were engaged at the time, wedding gown shopping. And she's in the back getting changed, trying one on. And the bat phone rang, and it was you calling me. And I had to make a decision. You know, do I take the call and answer the call of duty, or do I risk, losing my love life? And what do I do? It was quite the dilemma. So I thought, well, I'm a lawyer. I can figure this out. So I'm going to do both. So I went to the plus size section of the wedding gowns and hid behind them and took the call. I told my wife, yeah, I'm going to check out the dresses back here, and I'll be right back. And took the call behind the rack. And sure enough, you tell me, hey, Larry, we found it. And you were so excited. And the client had compression fractures throughout his sternum.
A transverse fracture through the sternum that was ununited, and ultimately ended up requiring 2 surgeries.
Yeah, they had to put a cage in his chest, and you saved him. Like, without you, his chest would have fallen apart. Like, literally, the structure of his chest skeleton would have fallen apart.
Well, what was interesting is the patient comes in and he said, Larry sent me here, my attorney, and he said, you're going to find the source of my problem. And I'm like, oh,
no
boy,
pressure, right?
Yeah, thanks, Larry. But he had actually been having pain for 3 months. And he had a CT scan where they couldn't find the fracture at the hospital. He'd been to the hospital twice. He had been to his primary care physician multiple times. They even sent him to a pulmonologist. And he's complaining of this chest pain and difficulty breathing. And everybody's patting him on the head, telling him he's just got a bone bruise. And ultimately, he comes in here, and just the relief. Look, nobody wants to find out that they have a fracture, but he was so relieved to know that the symptoms and complaints that he was experiencing were justified. And, that's another testament to Larry and his determination to make sure that patient is getting the right diagnosis and the right care. The settlement will come when the settlement comes, but the first priority is taking care of the patient, and I love that about you.
Thank you so much. And I can't do my job without top-notch physicians like yourself. And like I said, we've had so many cases together, and you're just an absolute privilege to work with. You do amazing work.
Thank
and
you.
I can't thank you enough for joining us on the panel today and being part of this huge conference.
Yeah.
What are you looking forward to the most about being on the panel?
Just sharing what we do. And I love, like Larry always says, I work with the best of the best. And I'm not talking about me. You look at that panel and you look at all the providers that are up there, and it is top-notch doctors. He works with the best. And to be around to be privileged to be in that group with those types of physicians, and knowing that patient's going to get the best care possible because Larry only works with the best.
I appreciate that very much, and you are the best, and I sincerely appreciate everything you do.
Thank
and
you.
Again, I can't thank you enough for being part of this podcast and the conference, and
Yeah.
I look forward to seeing you up on the stage.
Thank you. Appreciate it, Larry.
Take care. Thank you.
All right.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.